Good morning, everyone. The topic for today's lecture is dental caries, its etiology and pathophysiology. I'm going to cover this topic under the following contents, that is the introduction, definition, epidemiology, classification of dental caries, etiology of dental caries, pathophysiology of dental caries, conclusion and reference. Starting with that introduction, the word caries is derived from a Latin word meaning rot or decay. Dental caries and periodontal disease are probably the most common chronic diseases in the world. Almost every person has dental caries in their mouth, and it is seen in all geographical areas in the world, irrespective of the socio-economic strata, and its affect both the genders, male and female, and all age groups. Coming to the definition of dental caries, according to the Sturtevant, dental caries is an infectious microbiological disease of the teeth that results in localized dissolution and destruction of the calcified tissue, and according to the Schaeffer's, it is defined as microbial disease of the calcified tissue of the teeth characterized by demineralization of the inorganic portion and destruction of the organic structure of the teeth. Coming to the classification of dental caries, so depending upon the nature of attack, dental caries is classified as primary or incipient caries, that is the first attack of the caries on the tooth. Then secondary or recurrent caries, it is mostly seen after the restoration or below the restoration of the tooth. It is the second attack of the caries. So it is known as secondary or recurrent caries. And the last is the residual caries, which is left by the dentist intentionally and unintentionally. Depending upon the direction of the caries, we have forward caries and backward caries. Forward caries, it proceeds from the enamel to dentine. So in this caries, the the caries cone that is triangle in shape, it is bigger in enamel than dentine. Backward caries, it proceeds from DEJ towards the enamel. So if we see the caries cone, so it is bigger in the dentine than in enamel. And depending upon the progression of the caries, you have acute caries, which include nursing bottle caries, rampant caries, or the radiation caries. Nursing caries is usually seen in children who are on bottle feed. Rampant caries is seen in adolescent patient, and radiation caries is seen in patient who is undergoing radiation therapy. So acute caries is a rapidly invading process. More frequently, it is occur in children and adults. It involves several teeth, and lesions are soft and light colored, and usually involve pulp in early stages. The second is the chronic caries. Chronic caries, in this the lesions are long standing. Fewer number of teeth are involved. The caries is usually dark brown and leathery calcified dentine is seen. And last is the arrested caries, in which the progression of the caries has stopped, so it is known as the arrested caries. Then coming to the classification of caries depending on the age of the patient. So according to the age of the patient, we have early childhood caries, that is 4 to 8 years of age, adolescent caries, that is from 11 to 18 years of the age, and senile caries, that is in older age patient. Then depending upon the location of the caries, if the caries is present in pit and fissure, it is known as pit and fissure caries. If the caries is present on the smooth surface, that is either on the buccal, lingual, mesial or distal, it is known as smooth surface caries. If the caries is present on the cementum of the tooth, then it is known as the root caries. And depending upon the tissue involved, if caries is extending only till the enamel, it is known as enamel caries. If it extends till the dentine, it is known as dentine caries. And if it involves the root, that is the cementum, it is known as the cementum. Then coming to the GV Black classification. So GV Black classify the caries into 5 types, and class 6 is given by the Simon. It's modification of GV Black. So class 1 lesion, as you can see in this picture, it's involved the occlusal surface, that is, it is also known as pit and fissure caries. So it is mostly present on the occlusal pit and fissures of molars and premolars. It is also seen on the occlusal two-third of buccal and lingual surface of molars, and also it is seen on the lingual surface of maxillary and tegus. Coming to the class 2 caries, it is present on the proximal surface of the posterior teeth. So it is known as class 2 caries. Class 3 caries is present on the proximal surface of anterior teeth without involving the incisor. Class 4 is also present on the proximal surface of anterior teeth, but it involves the proximal, but it is not the incisal edge. Class 5 present on the cervical third of all the teeth, and class 6 is present on the cusp tips or incisal tips. Then coming to the etiology of dental caries, as you can see in this picture, for dental caries to occur, you should have a bacteria, a susceptible tooth surface, and a diet, that is carbohydrate diet or sugar, and a time. All these factors cause dental cavity. Okay. So factors that influence the caries etiology include the first one is the tooth, which include tooth composition, morphological characteristic or position. The next is the patient's saliva, and obviously the third is the patient diet. Starting with the tooth. So morphological characteristic of the tooth is most important to determine whether the chances of caries are more or less. As you can see, if the patient has deep bitten fissures, so the chances of food lodgement is more. So in such cases, the chances of caries also become more. So deep bitten fissure is a cause of dental caries. Similarly, if suppose the gingival is receded and root is exposed, so chances of root caries is more. Similarly, in subgingival areas where food lodgement are there, the chances of caries is more. And second is the tooth position. In malaligned teeth, the chances of caries is more because it's very difficult to clean those areas. So food and debris stay there for a more time, and patients are unable to clean that area. That's why the chances of caries are more in malaligned teeth. Coming to the diet, as you all know that fibrous and roughage rich diet, the chances of dental caries is less. If you have a soft and sticky diet, the chances of dental caries are more. Obviously, soft and sticky diet stick to the tooth surface and remain for a long time. That cause dental caries. While the fibrous diet clears all the surface and the chances of caries decrease. Also, the carbohydrate-rich diet has a more chance of dental caries, and fluoride and vitamins reduces the chance of dental. Coming to the pathophysiology of dental caries, so the microorganisms which are required for the caries initiation and progression. For the initiation of dental caries, the primary microorganism is streptococci. So for the primary initiation of dental caries, the streptococcus species can cause the dental caries. So these species include Streptococcus mutans, Streptococcus milleri, Streptococcus mitis, Streptococcus sanguis, and Streptococcus salivaris. And for dentinal caries, the main bacteria responsible is lactobacilli. So for lactobacillus species, they include Lactobacillus acidophilus and Lactobacillus casei. And for root caries, actinomycosis is the bacteria which is responsible. So for actinomycosis, the species includes are Actinomycosis viscosus and Actinomycosis naturally. So, and for the progression of dental caries, similarly, the bacteria for initiation, you have a streptococcal species which is present in deep dental caries and also in root caries. In dentine, you have Lactobacillus species, and in root caries, you have Actinomycosis species, which include Actinomycosis israeli and Odontolacticus. Now, coming to the conclusion. So, a thorough understanding of etiology and pathophysiology of dental caries is prerequisite to develop the method to combat the same. The diagnosis, prevention, and treatment of dental caries must be foremost objective of operative dentistry, and combined approach of clinical treatment and cavitated lesion with patient education and motivation are essential for effective management of disease. These are these are my references, that is Sturban from Cohen, from Schaeffer's, from Public Health, from Textbook of Pedo and Associated Laboratories.